So I'm going to spend the next 20 minutes just talking really from, as we said, the veterinary perspective about euthanasia and pet bereavement. And I'm predominantly going to focus on the decision-making elements of euthanasia, because the research that I've done and my experience in practice suggests that actually it's the decision-making prior to the euthanasia that can be amongst the most challenging for both vets and for owners involved in euthanasia. So I'm going to go through some of the scenarios that might occur and talk about some of the research, as well as some of the gaps in the research about these different scenarios. So my interest in this was really specifically heightened by my experience with my own dog, Barney, who, as he went into old age, developed osteoarthritis, a painful joint condition, skin disease, and bronchitis that made him cough and sometimes faint. And I knew that none of these diagnoses were necessarily specifically terminal, but that they would be likely to shorten his lifespan and limit his life. And I found it tremendously difficult to decide when the right time was to put him to sleep. And I still, 7, 8 years on, think, was it really the right time? Did I leave it too late? And so this really made me think, gosh, well, if I don't know when the right time is as a vet with all this experience, what must this be like for other people? Which led me then to do a PhD in this area. So the first thing I just want to briefly cover, since I'm talking from this veterinary perspective today, is the oath that veterinary surgeons in the United Kingdom need to declare when we join the profession. Our governing body is the Royal College of Veterinary Surgeons, and this is the oath that we're asked to declare. And what I want to really highlight is this underlined section. So above all, my constant endeavour will be to ensure the health and welfare of animals committed to my care. So that's our governing stance. That's what we should do at all times. Now, one of the challenges here is that welfare isn't specifically defined, and euthanasia also then isn't referenced in terms of welfare. And for many years in animal welfare science, there was a very influential paper that said actually euthanasia, death, is not a welfare issue, because you're stopping that animal from suffering. So it's a neutral to okay to good even thing to do. It's fine, it's not something we should have big ethical turmoil about. However, more recently, a veterinary surgeon, James Yates, put out a counter paper which said actually, well, maybe death, euthanasia, is a welfare issue because we're depriving that animal of potential positive life experiences. And I think this real ethical conflict, this which side of that line do you fall on in relation to, is euthanasia a broadly good, okay thing for welfare, or is it actually a negative thing, really underlines a lot of what I'm going to talk about today. And I'll just remind people of this at certain times. And I think that uncertainty, and I would probably describe it as an ongoing uncertainty, is something that both owners and vets, consciously or not, are trying to navigate all the time. So here's a kind of typical scenario. This isn't a photo from a euthanasia discussion. It's just a photo I'm going to use throughout the talk as an example of what, a situation of a consulting room. We have a veterinary surgeon, we have a pet, and nominally this is a dog. It absolutely could be a budgie, a rabbit, a cat, a horse, and we have an owner. And the humans in this room are hopefully working towards trying to do the best thing for the welfare of that animal. And so what I'm going to do through this talk is take each of the three kind of actors, as we would say, in this scene, so the dog and the owner and the vet, and talk about how they can prompt euthanasia discussions and decisions, and how challenging it can be when that individual does so. The first of these I'm going to talk about then is the dog. And I guess the situation that many of us as owners and probably as vets would hope for is that our pets indicate to us very clearly when the right time to put them to sleep will be. Often that can be through, a really sudden onset, collapse or bleed or loss of consciousness, or potentially it can be a very acute, sudden deterioration in a chronic condition where it's pretty clear, albeit that it's incredibly devastating often, that today is the right day to do this. What I found with my own experience and the research that I've done that's much more challenging is when actually both the vet and the owner want to do the right thing, but they're not quite sure what that right thing is. So the pet isn't giving you that extremely clear, today's the day kind of indication as to what to do. And this is something that we often talk to owners about in serial consultations with pets that have a life length limiting, quality of life, as we describe it, limiting condition, where we're starting to say, well, at some point this decision is going to have to be made. And I think the difficulty of making these decisions and the lingering uncertainty about whether that decision was made at the right point in time is one of the really big challenges around pet bereavement. I know Diane's going to pick up in the final talk in this session today. So kind of okay, better if the pet clearly indicates what the right thing to do is, more challenging if we're not sure. And often as vets, we find it really difficult to make these decisions for owners because we don't know that pet as well as they do. And we often use this term quality of life to say, well, you know, you'll know when the time is right. You'll know when the right time is based on whether or not your pet's happy, based on whether it's having more good days than bad days or vice versa. But actually my research indicated that it's not that easy to tell. One of the big difficulties also that we've discovered is that this term quality of life is quite nebulous. And so animal welfare scientists might define quality of life as what a dog, a pet, is feeling at some point in time. Now that's kind of good, you're putting yourself in the shoes of the pet, but it can be very difficult, especially if you're talking about snakes, iguanas, hamsters, some of these species whose behaviour we understand much less, to understand how it is they feel. Vets tend to use quality of life in much more of a specific health related way. So we talk about whether a pet is sufficiently ill or injured often to be put to sleep. We often use it with quite a negative framing, and we're saying, is quality of life bad enough to stop? When I spoke to owners during my PhD about what they thought quality of life meant, there was a huge diversity of definitions encompassing the animal welfare scientist definition, the vet's definition, but also owners that use quite simple frameworks to say, you know, is my dog eating and sleeping? And if they were doing that, then they thought that that was what quality of life meant. Now, some of us may disagree that that's what quality of life is, but one of the real challenges, I think, is where a vet and an owner having a discussion about quality of life in the consulting room, but aren't necessarily understanding each other's frameworks for what that means. So something I would highlight here for those of us in practice and potentially for owners as well, is to be really clear when you're talking about quality of life, what it is that you mean, so that you're making sure that the other person you're having this discussion with agrees with you with what parameters it is that you're looking at. But even making these assessments can be tremendously challenging. And that's something that's come up in several strands of research. So the top paper from Scandinavia in 2013 interviewed owners of chronically ill dogs and talked for the first time really to owners about what life was like, and highlighted that it was very difficult and that these owners lived the life of carers for elderly people, often actually with these chronically ill pets, and that their lives and codependencies became much more intertwined than they were when the pet was healthy. My own research is an example of it at the bottom there. Found a very similar thing with dogs with osteoarthritis, which I think was previously considered to be a relatively minor problem for owners. Actually, it can be a really substantial problem if your dog is large, difficult to move around. It can be very restrictive to your lifestyle. Also, these owners highlighted that because of the intensity of the caring that you need to do, it can be very difficult to be objective, to stand back and say, what is the right thing to do for my pet? When is the right time to put my pet to sleep? And so these discussions with vets in practice can be very important to help tie down these parameters, to help just keep checking that everything is okay to carry on. Again, the same group from Scandinavia did some nice work where they asked owners about what they thought vets should be doing in these discussions, what was their job? And they found that actually owners had a very wide diversity of opinions about what the vet should be doing. And my research also backed that up with UK owners. Some owners really wanted to be told what to do by the vet, bearing in mind that vets may find that really quite challenging to do because they feel they don't have the right information. So there's a potential conflict there. Equally, other owners said, well, actually, I know what I want to do, and I want to do it when the time's right for me. And I'll come on to how that can sometimes cause challenges, but often can be a good thing, again, if we've got that shared definition. So it's a complicated situation, this, when you're both not totally sure what the right thing to do is. We need better tools, we need better ways of having these discussions. And to be more sure that we are all doing the right thing at the right time. And I really think that this scenario really can be one of the most challenging actually for owners long term after a bereavement. Moving on, and I could talk for hours about each of these things, so apologies that this is a little bit of a rattle through. I next want to come to the scenario, which is, I'd say, much less common, which is where an owner will present a pet for euthanasia to a vet, where the vet's potentially somewhat surprised that that's the decision that the owner's come to. It may be that the vet's never met that owner before, or it may be actually that the pet has got something which the vet perceives to be a relatively minor problem. And these can lead to quite difficult situations. So sometimes a pet will walk into a consulting room and the owner will say, I'm here to have my dog put to sleep. And the vet will look at the dog and think, gosh, well, I'm not sure that's necessarily straight off what I would do. And again, for practitioners, I think it's incredibly important to recognise the interdependence of welfare between pets and owners. And I know this is something that we are all very cognizant of, but to really continually remember that actually, especially for dogs, smaller pets, maybe less so for cats that have indoor-outdoor access, you know, every aspect of that pet's life is under the control of the owner. Where it sleeps, how often it walks, where it walks, what kind of food it eats is all totally under that owner's control. And so if the owner isn't coping very well with looking after that pet, that potentially is going to have a substantial compromise on that pet's welfare, even though the pet itself in the scenario in front of you may not look too bad. So I think it's really important to explore with the owner why it is that they've come to this decision. Sometimes in the veterinary literature, this can be called convenience euthanasia, and there are probably, hopefully, small percentage of owners who do just decide that they don't want the pet in the life anymore, and that's, you know, the time has come to put them to sleep. And those can be very, very difficult situations for vets to deal with. And there's some research that's been done where vets were asked about what happened in these scenarios. So how did they feel? Because sometimes the vet will want to say, actually, no, it's not the right thing to do. I don't want to do that. And where we really feel that it isn't the right thing to do, we can start to use this term kind of moral stress and moral conflict, where we're saying, well, actually, I don't agree, but maybe it is something I'm going to have to do. And in this nice paper by James Yates and David Main, vets were asked how often and why they declined to euthanize. So when the owner had said, I want to bring my pet in to be put to sleep, you know, we do have a right as vets in the UK to say no. We have to then refer those pets on to somebody else. So we say, well, you know, here's these other people that might do it. But some vets will have a strong ethical stance that actually, you know, euthanasia is a welfare issue. It's not the right thing to do. And interestingly, certainly for you guys from charity settings, I'm sure you would recognise that behavioural problems is one of the big challenges here. And this seems to be a really dividing ethical dilemma between vets and potentially between vets and owners, that dogs with severe behavioural problems, whether that's fear, aggression, whether it's house destruction, whether it's aggression towards people, children, noise phobias, overtly look healthy, but behaviourally may be very unhealthy. And some vets find those dogs very difficult to euthanize. Equally, others will say, well, what are the other options for this pet? You know, it's going to get relinquished to a shelter where perhaps it will be unrehomable anyway, or perhaps it's going to, you know, end up being sold on Freeloved or Gumtree, which is something that we see a lot, unfortunately. And then the same problem will just be transferred to another household. So sometimes vets think, well, actually, on balance, it probably is better for this pet to be put to sleep. But these are very, very difficult situations from the veterinary perspective. What we really don't know very much is what happens from the owner perspective. So how it is that owners come into these situations, what it is that they've done before they get there, what brings them in on that day at that time to say, today's the day, enough's enough. And that would be a really useful area to do more research, I think. And there's been a nice review that's looked at the effects then on the vets and on shelter workers, people in biomedical research, where they are putting animals to sleep, but they don't really feel it's the right thing to do. And we're using this term moral stress here. So that's where you feel there's a conflict between what you have to do and what you want to do. And that can be a very difficult situation. You know, you meet vets who will remember for years pets that they've put to sleep. They didn't really think it was the right thing to do for that pet and aren't sure whether they advocated strongly enough for that pet, or has led to significant conflict either with colleagues potentially, or with the owner. But as I said, there's very limited research about the owner perspective here. How does an owner feel in this scenario where their vet is potentially saying, actually, I don't agree with your decision? That must be really challenging, I think. And it would be really interesting to know what happens next, both in terms of the bereavement that those owners may feel afterwards, and what happens if the vet does decline. So the final of these three scenarios then is what happens when the vet thinks actually euthanasia is the right thing to do based on their expert assessment of the pet, and perhaps the owner disagrees. And this is a situation that's probably more common than the counter situation of the owner presenting the pet. And it's certainly one that I've personally dealt with this week during my consulting. So sometimes we'll see a pet, we'll talk to an owner and we'll think, gosh, this pet is suffering really as we would describe it. Its welfare is sufficiently compromised that we think the time is ready to stop. Unfortunately, from our perspective, but equally extremely understandably in many circumstances, the owner isn't ready. They feel the bond with their pet perhaps is too strong to put it to sleep. Perhaps this kind of quality of life definition framework they're using isn't right. Sometimes they'll want other people to be involved in helping them make the decision or being there for them during that decision. So they'll want to delay it until, for example, a family member's back from holiday, back from university. And equally, we do very occasionally meet owners who just don't believe in euthanasia as from a religious perspective, and equally from an ethical perspective as well. We come back to that line of, is euthanasia a welfare issue or not? And some owners really would much rather their pets die. I think some of that is in relation to not wanting to have the guilt, again, as we've already described, of having to make that decision to put the pet to sleep. But again, these can be really challenging scenarios because you may enter serial rounds of negotiation with an owner watching the pet deteriorating in front of you. And recent research has really highlighted the impact this can have on the vet. So again, this nice paper in the Veterinary Record that was recently published was looking at the impacts of these decision-making discussions around euthanasia. And this bit that I've just pulled out here says, during prolonged euthanasia decisions, participants, that's vets, felt the strain they experience can become further aggravated by feelings of concern for the companion animal. Participants reported feeling a strong sense of reduced well-being when a companion animal's health was perceived to have consequentially deteriorated as a result of prolonged euthanasia decisions or a potential lack of euthanasia consultation. And so I guess in this talk, I'm kind of wanting to highlight really that pet bereavement can also affect vets, and it's maybe something we don't talk about enough. Maybe we don't provide enough support for vets. And I think that these decisions where they're not really clear cut, where all of the three parties almost don't agree with them, can be very, very difficult and can really lead to some quite long lasting trauma for all participants. So finally, I just want to finish really briefly with a series of 3 articles from a series that I published in the journal, The Veterinary Record, which are written by owners. And this first one is a lovely piece by Naomi Harvey, who describes her beautiful cat here, Dreamer. And she describes a situation of what's called anticipatory grief. So this is when you know your pet is unfortunately going to die, or you're going to have to make this difficult decision at some point in the future, and you start to experience feelings of the grief that will occur when that pet has passed away. And she describes how, at the beginning of this, when her pet was diagnosed with something that would be likely to be life-limiting, she almost distanced herself from her pet and didn't want to engage with them as much until she realised, courtesy of her husband, that that's what she was doing, and had to then learn how to overcome these feelings to be able to talk about the fact that her cat was at some point going to die. And I think this highlights a really big thing, that we're very good at putting in bereavement support after a pet's died. Obviously, that's when the bereavement's occurred. But going back to the theme of this talk, all of these decisions are really tough. And all of the time when you talking about these decisions, you're thinking about what it's going to be like when that pet is no longer with you. So you're kind of starting to experience anticipatory grief. And yet, perhaps even the naming of things like the Pet Bereavement Support Service, you haven't yet had a bereavement, so you may feel that you're not able to access these services, even though they're absolutely available to owners in these circumstances. I think we're not yet good enough at really reflecting just how tricky this kind of anticipatory grief waiting room almost can be. Second piece here by Catherine Oldknow, talking about her lovely black Labrador who developed osteoarthritis. talks in a very different emotive way about how she felt about euthanasia. And she felt actually for herself that when she put her dog to sleep, she was committing an act of murder. Now, that's an incredibly strong term, but she's spoken to other owners who would share the use of that term because they feel that what they're doing is they're booking a time and a date to kill their best friend. And a lot of her concern was again around this: did I do the right thing at the right time? Was it too late? Was it too early? I don't know if it was right. And she really is an advocate for vets helping owners to help to make those decisions less traumatic, really to help increase the certainty that the timing is right on that day, and talks again about the lingering feelings really after the pet's been put to sleep, and the impact that that had on her when she felt that she'd done something that maybe wasn't ethically the right thing to do. Finally, to bring it back full circle, another lovely piece written by a vet who talks in really devastating terms about the grief she experienced when her own pets died, and how that led her to reflect that she didn't want her pet to be treated in the same way after it died as she would usually, you know, potentially do with pets in her own clinic, where they went off to the crematorium with other pets, and how she wanted to take her own pet to a crematorium herself, to have that cremated, to have the ashes back, and to have a much more personal experience. And in this really quite harrowing piece, she talks about the moral turmoil really in terms of going back to euthanizing other people's pets and thinking, well, is it okay that I don't necessarily provide the same level of service and support that other owners do? Now she's had this insight into just how tough things can be, she really empathized much more with owners and found her job actually much more difficult as a consequence. And that's something that I think shared by many vets who've put pets to sleep in, you know, in recent proximity after having lost their own pet. It certainly can change your perspectives. So hopefully that's a really quick rattle through the decisions that are made and the challenges there, some of the research gaps. I think it's a really interesting area. It's a big area for lots more research. It would be great to see more funding coming into this. And with that, I'll hand over back